So today we will be talking about importance of health assessment. So let's start with what is health assessment. And this is straight from your book. It's systematic method of collecting and analyzing data for the purpose of planning patient-centered care. There are 3 different kinds of components of health assessment. I will write them here. Forgive my. So my very first one would be health history. My second one is physical exam. My third one is documentation of data. So when we are talking about health history there, that's when you're asking questions to the patient about their current status of health, what medications they're taking, their family history, and also their review of their systems. So that will be, most of that data will be coming from patients. So that's where our term subjective comes in. And second one is a physical exam. That's something you will be gathering by checking, maybe, for example, checking their blood pressure, checking their heart rate, looking at them and then inspecting however their demeanor is, if they're looking depressed. So that will be your physical examination part, where you will be using different tools and your expertise to collect that data. And in this course, we will be going over inspection, auscultation, and also palpation. Palpation comes before auscultation. Your book talks about percussion too, but we don't get into that one. And that's objective data. Third one is documentation of data. That's your legal document where you document all, whatever you have collected, all that data in there. You have to be very careful when you're documenting any of your assessment pieces, because you don't want your bias or your preconceived notions to show in that document, because it's a legal document and it's kind of like a permanent record that goes in there. And when we see that term subjective data, as I said, that's more like coming from a patient, whatever patient is reporting. So that would be their symptoms. For example, they might be telling you if they're in pain, if they're nauseous, if they are itching or anything like that. So that's subjective. Those are examples of subjective data. And objective would be your signs. So what do you see, whatever you are collecting? And sometimes there's that gray area too, that some of these things that can kind of go in either way. So if a patient is sweating, that's what you see. But they're also reporting, I feel very sweaty. So that goes both in symptoms and signs, and that would be subjective and objective data. And there are 2 ways to collect that data too. One would be coming from primary source. The other one would be your secondary source. Your primary source would be your patient himself or herself giving you that information. Your secondary data would be coming from maybe a family member, their neighbor, or their loved one, or whoever brought them to that clinical facility. And your patient is unable to answer your questions for one reason or the other.